Namaste and welcome all of you to Gurubodha 104th episode. Welcome to all our participants to this particular session, and I cordially welcome on behalf of all of us, Honorable Gururaja sir, to this particular session. Welcome to Gurubodha session, Gururaja sir. Namaste. So we'll begin. First question, Gururaja sir. How to manage high cholesterol and triglycerides in an Ayurvedic way? So this is an important area of discussion. Cholesterol, triglycerides, points of concerns, plenty of cases, even the young patients. So obesity related, diabetes related, lot more cases into our clinics. So sometimes it is a challenging scenario to handle these things, but Ayurveda has handled these conditions effectively in comprehensive approach through many perspectives of approach, including the therapies, including the panchakarma therapies, and also the dietetic protocol changes, medicines, lifestyle changes, and lot more will be needed in this particular context to address these issues. Let me take over this question to Gururaja sir. Sir, so how to look at these conditions from a clinical perspective of handling triglycerides, high triglyceride values, and high cholesterol cases in our clinical practice?
Definitely, it is a problem of the modern world. Nowadays, we could see such type of cases. Definitely, we need to understand there is a typical connection between the food and the type of food what we consume is associated with the cholesterol. Of course, basically there are two issues. One is if it is genetically predisposed, that's called a familial dyslipidemia, or such conditions are there. In a family that condition runs, maybe due to some gene defects or something like that. But other than that, there is a very clear-cut indication that diet is associated with these problems. So we need to optimize our diet very critically. How much is required for a person, that has to be understood by the person only by reducing the diet of quantity of diet what is consuming very periodically. So when he does like that, definitely he will come to a place where he can understand that this is an optimal thing. Below that, if he consumes a food or quantity, then he may feel a little bit of tiredness. Just to avoid that balance to that level, one has to maintain. Then the things will definitely come your way to reduce. That is the point number one. Restriction on the diet and the diet which is quantified or restricted but still very rich in energy, that needs to be curtailed. We need to select such a type of foods which can at least reduce the what you call the energy intake into the body, but somehow for a time being maintains the bulkiness in the stomach in order to overcome, not to have the side effects of something like acidity and or something like that. So this can be managed, one part of it. Second thing, we have observed those who are purely vegan and vegetarians, they tend to have increased triglycerides in them. So this may be associated with the type of food what they consume, because most of the vegetarian diet, they'll be pro-carbohydrate rich, and definitely that carbohydrate, excessive carbohydrate in the body will get converted in the liver into triglycerides later because of the intrinsic cholesterol activity. So thereby it leads to a lot of triglycerides are rich in them, and it is having an increased quantity present to that. In order to reduce these things, we need to go for, one is to cut down on the diet pattern. Second thing, certain protocols or the procedures. For example, if you go for regular Virechana type of thing, it may be in a very called mrudu Virechana, we can call it for a time being. Thick mrudu Virechana regularly giving goes on, detoxifies the liver, and thereby it excludes the intrinsic cholesterolic material through the gut. So thereby it avoids the excess formation. So thereby it also helps. The other way is there are certain drugs which can be used to control or convert these rich cholesterols or bad cholesterols and improve the good cholesterol can be done. But Santarpana Rog is something like that, where obesity is also associated, and we have such a type of patients wherein they are very lean and thin, still their lipids in the blood will be very rampant and very high. So we may have both the patient having a normal lipid levels and a very requirement, body type of the person, nature, food, everything we need to have typically handle this high cholesterol. So it will be typically from case to case, accordingly the management should be done. We have got so many chilling drugs which are anti-cholesterol or which are tikshna, lekhaniya in nature. That type of drugs can be used in that, and most of the time it is very clearly said, and one which is guru in nature, manda in nature, snigdha in nature, will going to enhance the, and it is suksha, it's going to break the body. So like this, we can go for a very typically evaluation, and accordingly to case by case, we can plan.
Thank you, sir. Thank you there. The secret of managing these issues, which are also so Hitabuk and Mitabuk are the secrets of managing these issues, like maybe triglycerides, high triglyceride levels or high cholesterol levels, which are very common and related to the obesity also. So we know that once the person is obese, the person is always susceptible to these conditions. The chances of getting high triglycerides, high cholesterol in the blood levels will be more. So it will act as a risk factor. Obesity, diabetes is related, hypothyroidism is related. All these lifestyle disorders come together. So Hitabuk and Mitabuk, as you mentioned rightly, Gururaja sir, with interventions like Virechana and suitable medications, as you also pointed out, that we shall handle them on one-to-one basis. So what kind of diet? So can we generalize, or it should be customized as per person to person, or should we see through the Vikruti and then handle person to person? So how should be the diet approach, and what are the common things which can be avoided in people who are having high levels of triglycerides or cholesterol levels, and who are really worried what to take and what not to take? Where to focus on the diet, sir? Because you are focusing on the diet, which is an important strategy in handling these cases.
Definitely, we need to, first of all, this is what I understood. Basically, what we have understood is that we make a mistake in just totally changing the diet pattern of a patient. First of all, we need to take the entire history, his our diets, what are the things she or he consumes. Then based on that, whether it is rich in carbohydrate, whether it is rich in proteins or fats, accordingly we can customize all these. You are consuming this much of more carbohydrates, you can reduce this one. You are consuming less protein, you can increase this protein like this. Or you are consuming saturated fatty acids, so something like that. Or you are consuming more Ashandi ahara, which is more madura in nature, that needs to be cut down. So such type of pattern should be done, and you are unnecessarily just shifting everybody from one to other as a standard protocol may not be a right one.
Right, sir. Thank you there. And a couple of questions in the question box. Kalaji asks, Sir Namaskar, did you say that Virechana can be done for high cholesterol with Tikta Gruta? So will this ghee not bring the cholesterol high? So that is the question, sir. Gururaja, sir.
Definitely. We can go with any gritas as a Snehana Karma before that but in any case, we should not feel like that the grita can increase the cholesterol. We have seen many times, even the gritas are fed to a patient in Arohana Krama too. After that, when Samsarjana Dharma is done, then once again after 20 days, 15 days, when the blood shows that it is higher than the previous one before the starting treatment. So anyway, our Tikta Grita, Panchatikta Grita, any type of these gritas are the medicated ghees. It won't increase the lipid pattern in the human in any way. It's usually not possible, and it is not done. And it won't create such problems inside. Then secondly, We are just giving Nityame Virechana in the form of mrudu Virechana, what I said, where we don't need to go for a giving regularly Grita or something like that. It is a daily based. Patient forced to have 2 to 3 bowel evacuations per day in a natural way. So this will enhance the condition. There is no need to give something like as a regular Virechana, give some Snehapana for 7 days and no, not like that. It is on a regular daily basis, giving a patient to such type of mrudu Virechana dravyas, where patient is subjected to go for or may attend the 2 to 3 nature calls per day or able to pass the bubbles. So such is the intention and that is the protocol.
Thank you, there, Gururaja sir. There is one more question in the question box, sir, to Gururaja sir. How much increase, if any, is acceptable in post-menopausal women? How much increase? Like, I think Joe Maringi asked this question. Maybe that is related to the triglycerides or cholesterol. If at all, if there is an increase in the post-menopausal woman, how much is acceptable?
See, there is one wrong assumption we usually do it. What the WHO or the so-called medical fraternity has given some guidelines, it is for just for the sake of the guidelines. See, we have a different set of human race. The European humans are not looking like same as Indian or Asian continent. And even in Asia, the Japanese and Chinese, they won't look like Indians. So even the South Africans and the Africans, they don't look like Indians or even Americans. So even though we all as human beings, it is not fair that to give us some guidelines that cholesterol should be there from this much to this level as an acceptable range for everyone. That may not be sound good. That is the height of an Asian male may be different when compared to an average height of an European or American male. Similarly, in case of females. So it is not a right thing to argue and that point that which is a right one, which is acceptable. See, it's an average. So something near to that is also acceptable. It doesn't mean that 160 or 200 is acceptable, and if it is 201, then we need to be worried. No, it is not like that. So something around that 200 levels of cholesterol, that is good. If it is said that it is below 30 or below 40 of HDL, high density lipoprotein is not good. It is something around that means it's an alarming situation. I guess giving an alarm warning that needs to be corrected. But doesn't mean that it should be as something wrong and we should fall behind that and just do the things and changes. No, it is just an alarming situation and an alert. So we need to take that alert and reduce our diet, increase our physical activity. The things will settle down in few months, definitely few weeks to few months.
Thank you, sir. Thank you to Gururaja sir for clarifying that question. So again, to coming to that Joe Maringi's question, I would like to add up to this. Gururaja sir has answered it in a very balanced way. So here there are some normal and abnormal values. So according to the bio things, what we look at. So the blood reports when we look at. So always the higher numbers are scary numbers. So we should be very cautious to keep them in the baseline, like below the like what we can call it as maximum levels or around the normal levels. We need to keep, whether it is triglycerides or hypercholesterol, that is excess of cholesterol, whatever it is there, the bad things in the body, we need to keep it under the balance within the normal range. Anything very high and some things below the normal levels also will be very dangerous. Ati and that is Vruddhi and Kshaya, so both are not good. Here we need to keep them around the baseline, so around the x-axis or around the normal values. And having said that, people have like a panic situation when the numbers are slightly increased. So that is why we call them as biological variables, because they keep on varying from time to time. They're not constant, varying maybe towards the higher side or towards the lower side. So once there is variation, we should not be like obsessed with the numbers. If constantly on multiple readings we are having higher level, and if there are some recommendations from the doctor, they shall be followed, and one should put sincere attempts in taking the medicine, in following the treatment protocols, exercise, lifestyle variations, dietetic corrections, all those things, and try to keep them under balance. At the same time, the number should not be in the head. So they should not be running in our head, and they should not create a panic situation, because that only builds up stress, and stress will only worsen the condition but not ease in the condition. So we should accept that the biological variables will be going on upper or lower side of the scale, but when they're constantly higher or constantly lower, our attempts should be to bring them to the normal line and try to balance them around the normal. Servicing is important in healthcare system, but at the same time, maintenance, whether it is a vehicle or a human body, servicing is important, followed by maintenance. If maintenance is not done properly, back it will come to the servicing levels. So normal triglyceride levels should be ideally below 150 mg per dl, ideally. So it can be less than 100, it is really good. And when it comes to cholesterol levels, 190 mg per dl, here again cholesterol levels vary depending on the risk factor, how many risk factors you have which contributes towards the heart conditions. That is very important. So for different people with risk factors or no risk factors, you have a freedom to have 190 mg per dl or a little more than that. If you don't have any risk factors of cardiovascular diseases, I'm speaking about the cholesterols, and more than 160 mg if you have at least one risk factor. So like with another major risk factor associated with it, and when risk factors add, the number reduces. So like you can have only 130, around 130 mg if there are two risk factors. Again, what are these risk factors? Age is a risk factor, increased BP is a risk factor, familial history is a risk factor, and premature atherosclerosis which is running in the family, and tendency to develop heart disease is a risk factor. And there are so many, and low levels of HDL, very important. These are also risk factors. So the cholesterol levels, the freedom of having higher or lower value depends on how many risk factors are associated. Triglycerides. Having said all these things, the basic line is have them within the normal range. Gururaja sir.
Definitely. Another one point, we need to be very careful in handling these patients. We should not be strict on such that we need to keep it within that level of 150 only. Many times I've seen people, when they start doing this and trying to bring it down, they lose their charm. For a period of time, their kanti will go down, their body mass will go down drastically, and even they'll have problems with their tendons and muscles, and many other issues will arise. So we need to be very careful, because the cholesterol, it is a kapha tattva in the body which is giving bala to us, and that bala, natural strength, will be lost if you go beyond certain limits to a downtrend. So it should not be done. We need to have a balance. So that's why what the WHO or the world community has given us some standards. It is only just a guideline. We need to be somewhere around that. If it is on where, just like as Dr. Gram said, and repeated evaluations or a blood work, when the patient lipid evaluations, when it is done at a periodically of 3 months gap, or maybe 2 times or 3 times in a year, then all the 3 occasions, if it is showing a higher, then it is a concern. Then if a person has any reputation of family history or something like that as a alerting factors, then definitely we need to be concentrating on that, how to reduce it and how to maintain it. Otherwise, we need to have the balance of cholesterol also, because cholesterol is the one which gives a very good body shape to us. It is one of the important material for the new gel cell to develop, and new cell wall is made up of also cholesterol. So like that, cholesterol has a lot of plenty of roles in the production of hormones. So we need, and it is also a strength. It is a shakti. So that needs to be maintained. It doesn't mean that that's why many times they'll go in a very drastic way to reduce that cholesterol. It ultimately becomes a wear and tear disease for them. The cholesterol is reduced, but they'll have a lot of other issues. So that should not happen. You should have a balanced one, something around that. But doesn't mean that if 150 is normal, if it is 160 means, oh, I have got to try triglyceride. No, don't worry about that things. It's very much around that. It is always a balanced one, and it is good.
Thank you, sir. I would like to hand it over to Hebbar sir from here.
Thank you, Dr. Raghuram sir. I just want to bring in one more factor that is seen with high cholesterol, that we may not be concentrating much upon. So this is from, this sentence is from healthcentral.com. It says, non-alcoholic fatty liver disease, which occurs in person who don't drink alcohol or drink in moderation. Experts are not sure what it causes, but Dr. Says that people with NAFLD often have higher levels of LDL cholesterol and lower levels of HDL. That is one statement. And another, there is Keck School of Medicine of USE. In that, they are saying that constant increased cholesterol levels, excess cholesterol accelerates the damage of fatty liver disease. We know that the maximum cholesterol metabolism and even production happens in the with the help of the liver. Liver manufactures the cholesterol so that the body needs of the cholesterol is maintained. My question first to Raghuram sir and then to Gururaja sir is that if cholesterol levels are constantly high, of course we need to be a little wary about its effects on the liver, its effects on the heart and vascular system and so on and so forth. Raghuram sir, probably we need to concentrate on liver also to maybe correct fatty liver disease or any subclinical level liver damage that is cooking behind the screen.
Okay, sir. So we need to focus on the liver also, the liver health, and how the liver is involved in these activities or the metabolic process. Liver is a very important organ. So we know it has multiple roles to play. And one of the very common diseases afflicting this liver is whether it is alcoholic liver disease or non-alcoholic liver disease, fatty liver disease, what we can call it as. Looking at from the Ayurvedic way, so again, liver is the seat of Raktavaha Srotas. So Raktavahanam Srotasam Etut Mulam Plihamcha. So it is the seat of the roots of the blood transporting, conveying, manufacturing centers, a lot of things to do with the blood, right from the fetal circulation. So the liver plays that particular role of managing the blood dynamics in the system. And blood is one media through which these triglycerides or cholesterol or bad lipids or good lipids, or these things are carried, the lipoproteins, everything are carried through the blood media from one place to the other. It is again the blood vessels in which the blocks happen, atherosclerosis and other things. So looking at all the way, and liver involved in the metabolism of these things, we need to give concentration and focus towards the yakrit or the liver. And one more thing is the liver is also a pittasthana, a very important pittasthana. Ranjaka pitta is one subtype of pitta which is manufactured by the liver, and it again is compared to many liver enzymes which are taking place in the metabolism. Okay, Ranjaka pitta is compared to bile and whatnot, and so many things which are produced by the liver, which is coming to the intestines and again acting on certain food ingredients and converting it into certain things. So the liver enzymes all put together. So it's a broad spectrum discussion again, Ranjaka pitta. So according to Ayurveda, the Ranjaka pitta, according to Vagbhata, it is present in the stomach. And according to the other sciences like Sushruta, it is present in the liver. So these are considered as the components, that is the pitta, which is giving Ranjaka means to color. It is the basic thing which colors the blood. It is the basic thing which colors the blood. Ranjaka pitta gives in parts color to the blood. So when the rasa dhatu or the rasa tissue, the first product of the metabolism or the digestion in the stomach and the intestines, ahara rasa is formed, and from that is the extract of the food what we have taken in the juicy form, that forms the rasa dhatu, that is the first tissue. And that rasa, it's compared to the liquid component of the blood, the plasma or the serum, whatever we can call it as. And the solid component is called as rakta, blood cells. All the blood cells are considered as rakta here. And when that rasa passes through this particular liver, again we are speaking about the nutrition. The main essence of the nutrition, when it is passing through the liver and spleen, there the Ranjaka Pitta acts on them and converts that into the blood. So liver, lot of things are going through the liver. Liver is also a detoxification agent. It is also a metabolizing agent. It participates in the fetal circulation and lot more functions the liver is rendering. So when we come to this cholesterol and fat related conditions or fatty liver disease, the liver health also should be considered. So considering that it is a Pitta sthana, we should consider it as a Ushna sthana. So Pitta is basically hot in nature. So that is why we consider the liver also as a hot zone, like a hot zone belonging to the Pitta. And here, the fatty liver indicates the development of the fat or accumulation of the fat, or something happens with the fat metabolism involving the liver. When we see that, it is considered as fat belongs to the Kapha group of elements. Now, there are tissues which belong to different compartments, like the bone tissue belongs to the Vata, blood belongs to Pitta. So Ashraya Ashraya Bhava we call it as. So like the Vata lives in the bones. So bone is one of the seats of Vata. Blood is the important seat of Pitta. Pitta stays in the blood. We were speaking about Ranjaka Pitta. And almost the other tissues live in Kapha. So that is Kapha lives in these tissues. Sorry, putting it the other way. Pitta in Rakta. So Kapha is present in Mamsa, that is muscle. Kapha is present in the Meda, that is fat. In the Majja, that is bone marrow. In the semen, that is reproductive tissue. So majority of the tissues in the body are having Kapha as the component inside them in Ashraya Ashraya Bhava. Ashraya means a home, that is a residence. Ashraya means a resident. So Kapha is a resident in the Medas. So when Kapha increases, the Medas increases. When Kapha increases, the fat increases. So here fatty liver can be understood as a condition wherein the Kapha and its component, so that is the fat, or the fat and the Kapha, both which are cold in nature. Kapha is cold in nature. So that is why the Medas, that is the fat, is also cold in nature, because Kapha is located in the Medas. So that is the fat. Having seen this, the fatty liver can be considered as a condition wherein there is extreme development of coldness in a zone of heat. Actually, it shouldn't do. So like putting water on the fire, the metabolism of the liver will be disturbed, will have been disturbed in this particular condition. So when we look at it from the Ayurvedic perspective, the Kapha mitigating or the Kapha destroying foods, life activities and everything, the Meda depleting treatments, okay, so including Deepana, Pachana, Rukshana, Svedana, Udvartana, Virechana, okay, and even Vamana in some conditions, and Sroto Vishodhana, so to cleanse the Srotas, the Meda Srotas, and also detoxify the system. Lot more things need to be brought. The Staula Chikitsa, the Medohara Chikitsa, the Medoha Sroto Dushti Chikitsa. I'm using the Ayurvedic terms, sorry. Everything is related to the Medas, the contamination of the fat by the doshas. Let us take, there is an increase of Kapha in the fat tissue. So that further increases the, disturbs the functions of the Medas, that is the fat. So a lot more dynamics are taking place here. And we also need to see the Agni, very importantly here. Agni is the fire. So we have a central fire and we have the distributed fire everywhere in the body. We also have Dhatu Agni. Dhatu Agni means there is a fire in each and every tissue according to Ayurveda, which permeates or takes only what it wants, that particular tissue, and digests and metabolizes it and uses it according to its convenience. So here there is a fire in the Medo Dhatu, we call it as Medo Dhatu Agni. So the fire which is present in the fat tissue. What is its job? Its job is to take the active ingredients from the essence of nutrition and convert it into the fat. So that is the body supporting fat. We are not speaking about bad fat. When that happens in excess, the Medo Vruddhi happens. The Medas increases or the fat increases. The deposits increases. So the increase of Medas can be in many ways, like a Baddha Medas and Abadda Medas. The fat has certain areas in the body where it can go and sit and fix, and there is a quantity of fat which keeps moving, the free fats. Such fats can produce diseases like prameha, diabetes in comparison, and many other urinary conditions and many other metabolic conditions. So this is a big process. As coming to this particular question, again the Meda Dhatu Agni should be considered. The fire in the Medas, in a tissue, if the fire increases, the tissue will decrease. We need to understand this. When the fire in the Medas or any tissue increases, the tissue will decrease because the fire will burn the tissue. Okay, but when the fire decreases, the tissue will increase. The Medo Dhatu Agni, we are speaking about the fire in the fat tissues or the adipose tissues or the lipids, which help them in regular conversion, metabolization, and throwing them away from the body and maintaining a balance. That balance is lost when the fire is decreased or increased. Here, when it is decreased, when the fire inside the fat tissue is decreased, fat components increase. So here is where we need to do the Agni Chikitsa also. We need to focus our treatments. That's why I was mentioning Deepana, Pachana, everything, to kindle the or to enhance the Jataragni or the basic, the core digestive fire. And along with that, we know that there is a feedback mechanism between the Agnis or the fires. If there is one correction, there will be other corrections also. If there is a stubborn Mandagni or deficit fire inside the Medas or the fat tissue, we need to address that also. So in doing that, we need to focus on treating individual tissues. So this is all about what we need to understand about the fatty liver in this particular relation, how the pathogenesis take place, which doshas are involved, and which tissues are involved, and where to manage and how to manage. Over to you, Professor.
Thank you, sir. So when we look into the Ayurvedic medicines, especially the proprietary medicines that are used for the treatment of cholesterol, I am now in ayurmedinfo.com. I'm looking at liposem and then lipistat. Most of them start with lipan, etc. Gururaja sir, I see repeatedly there is Guduchi, there is Guggulu, there is Arjuna, then there is garlic, Bilvamula, Shunti, Gokshura, Punarnama, etc. So in some ways, also I see, so that is one question. So most of the, even Kutiki also has a role to play in decreasing cholesterol. So both, some correlation can be drawn with cholesterol and liver functions. Sir.
I think in the initial part of this today's program, we have already spoken about the involvement of liver in the manifestation of intrinsic cholesterol, even how it converts from the carbohydrate to the triglycerides and later the cholesterol, all these things. Definitely, there is a role to play by the liver in the manufacturing and as well as the maintenance of the cholesterol of the body. Very typically, if you feed the system with heavy doses of nutrition, liver has to do the metabolism. And once it is done, obviously it has to keep it somewhere. So it converts it in the form of triglycerides and stores in the adipose tissue and wherever it is available. Then the second thing is that whenever such type of santarpana janya or even the medo increasing dravyas are the excess food, which leads to the increase of kapha tattva in the body, automatically the one which convert these things to metabolically in the body to the depositions or adipose tissues is the liver, which is there is a conversion. So definitely it also gets covered with the fat. That's what happens with a fatty liver. And that's why when you want to improve the function of the liver, it is always better, and also avoid unnecessary absorption of all the things which is getting digested from the gut. It's the better way is to give a mrudu virechana or nitya mrudu virechana on a daily basis, where a person will have at least 2 to 3 loose motions per day. So this will not only clear or detoxify the liver, it also improves the liver by its function, and it also removes the excess content from the gut, and thereby it helps to maintain the healthy cholesterol balance. This is point number one. Second thing, when we use a lot of medication for the purpose of overcoming this cholesterol issue, definitely, as Dr. Raghuram has very clearly suggested, it belongs to the cholesterol portion belongs to the Medas in Ayurveda, and it is having Ashriya Ashri Sambandha with Kapha. So it is basically a Kapha Tattva Dravya. In order to overcome that Kapha Tattva Dravya, we need to have something which is Agni Tattva. So whatever we are using, usually will have a Deepana Pachana effect, and such type of combinations are used. So if you observe any of the combinations made with the proprietary medicines which is used for the hypercholesteremia, it do contains gugulu as one of the important ingredients, because Purana gugulu is very well established drug for hypercholesteremia. Then we have, because of the hypercholesteremia, what is the other organ which is going to be affected is the vessels as well as the heart. So the people have incorporated Arjuna into that. Arjuna is also having Kashaya Rasa, but still it has a special effect of controlling the activity of the heart, and it promotes the heart, and it is Hrudya. So, and otherwise, the Guduchi and such type of drugs have been added, which is Rasayana in nature. So, if it is Rasayana, then definitely try to maintain the balance. So, based on these things, and even Tikshna Dravya, which is required to kill or break down the lipids, that's why certain combinations have Lashuna in them. So otherwise, as a general principle, in order to have these avoiding blockages, increasing the Agni, doing the Pachana and those things, Trikatu or Chaturjata or Chaturushana, these type of drugs are very, very good. As well as, along with this, any Pramati Dravya like Maricha and Vacha, these things are also very good to overcome these problems. If we add along with these type of Ushna Dravyas, even the Amla Dravyas, which is because it's very clearly said, Amla Raso Udyanam. Amla Rasa is good to the heart, because Amla Rasa avoids agglutination of the blood corpuscles. So thereby, clot formation can be avoided. So definitely, this will be good. So this effect will be there on that, the blood components. So that's the reason many a times we use such type of the sour material or amla dravyas like amalaki, dadima, nimbu, or the jambira, something like that. These drugs can be used. So in such combination, if you balance it, definitely it is going to help these conditions of handling the what you call hypertriglyceridemia or even the hyperlipidemia or dyslipidemia. Another important one is Tikshna, in this classical combination is Lohasava. Lohasava can also be used to, because it's one of the Karshana yoga, definitely it can be used to reduce the cholesterol pattern. But definitely adding anything which is supportive to the liver and improves of course, Virechana is one of the important function which helps to support the liver. So definitely Nitya Virechana with mrudu, it's not only it's a drastic one, maybe 2 to 3 times a day, that will definitely give you a result over a period of time because of regular thing. So this is a very methodical and classical approach. And of course, the patient, as I already discussed, we have a 2 type of patients. One, those who are obese, the Sankarpanat Vyadi, something like that, wherein the hypercholesteremia or something like that will be seen. The other one is patient is of normal weight and lean and thin, but still cholesterol and triglycerides are very high. So such type of things need to be approached in a different manner. And of course, another one is if those who are having a familial tendency of dyslipidemia, then the approach according to the Rogibala and Rogabala, one has to increase the dose and the duration of the medication and even everything as per the one's requirement.
Thank you, sir. Which drugs are used for the mrudu virechana and for how many days? Gururaja, sir.
Definitely we can go for Swadishta Virechana Churna. Swadishta Virechana Churna is one of the best options. Then we have got Yeranda Brista Haritaki. Yeranda Brista Haritaki is one of the important combination what we can use. Even there are many products in the market based on the person-to-person Rogibala. We can use like Vasulax is there, one tablet. And we have got Sonamukhi containing drugs like even Anuloma. There are many other combinations we can use it. And even the Purilax is one of the combination. But of course, Purilax is comparatively stronger. We need to be taken care. The point of person to person based on the capacity and the disease condition. Accordingly, we need to select the drugs. So these type of things will definitely give the person. Even simple Haritaki Churna with Guda is also a very good one, which gives a very good purging. But needs to be taken. That dosage, form, everything has to be calculated as per one's requirement. It is totally customized one. It cannot have a standard package, something like that.
Thank you, sir. And coming to low levels of HDL, if all the parameters are okay-ish, but the HDL is low, what could be the strategy there? Gururaja sir, please.
What I have observed in my practice is when a patient having a high triglycerides or high LDL, VLDL and low HDL, what the approach we do to reduce this LDL and VLDL, automatically simultaneously same thing will also improve the HDL. So there is no special treatment or requirement to improve the HDL. Of course, the drugs will almost remain the same. So one is the physical activity of the person. If it increases, that's also going to help us a lot. Then we can use any of these mild Virechana type of drugs. Definitely that will also help. And of course, if it is required, we can go for Amla Rasa Dravyas more in order to increase the HDL. Definitely it will increase. But there is no specific drug only to increase the HDL. I have not seen any such drug in my practice. I have not come across. So that is not possible as such.
Thank you, sir.
Since we are discussing this particular topic, I would like to put forth a small hypothesis which we can discuss later in elaboration in some episode regarding this triglycerides and also the cholesterol. So I'd like to cover it in 5 minutes, just like where to look and how to differentially look at this particular condition from Ayurvedic lens and Ayurvedic perspective. As I said in the introduction of this particular session itself, that obesity predisposes to these conditions, high triglycerides. It's a risk factor for triglycerides and cholesterol, etc. Looking at obesity, high triglyceride levels, high cholesterol levels, hyperlipidemia overall, when we consider, all these things can be considered with one thing in Ayurveda, that is medas, that is the fat. So the bad fats, good fats, everything. And Gururaja sir also pointed out somewhere that it is very important to have a little balance of sneha in our system. That is the lipids, cholesterol, maybe triglycerides, everything are otherwise helping in the body functions until and unless they go above the axis or below the axis. Now, how to read these things? Now, there is a condition called as Medo Vruddhi in Ayurveda. So Medo Vruddhi, all these things, textual references you will get. Medo Vruddhi. So first of all, in basics of Ashtanga Hridaya and in the first year BNS, we learn about the Dhatu Vruddhi Lakshanas. That is the signs of increase of the tissues. There is Medo Vruddhi Lakshana. So Medo Vruddhi Lakshana, Medas increases in the body quantitatively. It is represented by some symptomatology. So like Alpe Picheshtite Shwasam. So like with small activities itself, the person feels very discomfort and dyspneiatic. And speaks Tanodara Lambanam. So there is accumulation of fat around the butts and also the breast and also the udara, so that is the belly. So these are the signs. So these are the anatomical signs of the increase of fat. When the fat increases in the body, as I already said, it may be in the baddha form, so that is in a seated form or a fixed form or an abaddha form. So it is floating or it is traveling in the system through the blood channels or the ducts of the body. So here, Medo Vruddhi points out towards a condition where anatomically we can see the fat is increasing. The body is clearly showing that particular condition. So then we are having two important terms in Ayurveda, Staulya and Atistaulya. So in modern also we have overweight, obesity and severe obesity. Depending upon the BMI, we have classified those conditions. And obesity predisposes to this hyperlipidemia and hypercholesterolemia and all those conditions. So when the Meda increases in the body, what it does? One, it shows something outside the body for us to see. What is that? Staulya, the person looks a little larger in frame. Atistula, as explained in Ashtanindita Purusha, like there is a chapter in which 8 socially unfit people have been explained, despicable people have been explained. There a word called as ati staulya comes. So here, these are the Ayurvedic terms which indicate the anatomical disfiguration of an individual due to excessive fat. So one is, first the medas increases in the body. Why it increases? Due to our food activities and all those things, disturbance. And then the external presentation is in the form of staulya and atistula. Atistula is above the margin. So stula is somewhere in between. So like moderately obese, we can consider this particular condition. These things are happening outside the body. And at the same time, there is a different picture inside the body. Something is happening inside. What? There is Agni-mandya, so there is a disturbance or the low metabolism in the body. That as a feedback mechanism or individually, the Medo Dhatu Agni, which I already said, the tissue fire of the Medas will decrease. There is increase of fat there inside the body. That fat itself is accumulating everywhere and showing to us in the form of stula and atistula externally. Internally, there are some other pathogenesis which is taking place. One, the Agni-mandya, then the Dhatu Agni-mandya, that is the less fire in the tissue, that is the fat tissue. With that consequent increase of Medas. Increase of Medas. That increase of Medas travels in the body with the help of Vayu. It is pushed here and there through the channels. And some part of that Medas gets settled here and there. That we see it as obesity or the accumulation of fat around the butts, abdomen, central, that is belly, and around the breast and somewhere some other places in the body. And the other part of Medas is going just freely moving in the body, and that can produce many diseases like prameha and other conditions, Medoroga and other conditions. These are the things which are happening inside. And what is happening when the fat is floating inside the blood vessels? So it can either be floating or it can adhere to the walls. As long as it is floating and it is contaminating the blood and the channels in the body, it is going to different parts of the body. We consider that as Vedo, Vaha, Sroto, Dushti. So there is a contamination by the fat of the channels of the body, or the transport system of the body is contaminated by Meda, or the Medo Vaha Srotas itself is contaminated. The roots are contaminated. So this means to tell that the fat is either not formed properly, not transported properly, or not stored properly. Somewhere in between, it is a suspended animation state of Medas, Medo Vaha Sroto Dushti. And from Medo Vaha Sroto Dushti, contamination of this fat transporting or managing channels, many pathological features come out. Like there may be Medo Avruta Vata. So we know Vata is freely moving everywhere in the system, including in the blood channels. So when the Medo Avruta Vata, when the Medas envelopes the Vata functions will decrease and it will lead to a set of disorders. Medo Gata Vata. So the Vata simultaneously which is vitiated can enter into this pathogenic fat and it can cause a condition called as Medo Gata Vata. In one of our previous episodes, Dr. Saujanya was speaking about the Gata Vata stages, and in the next episode, probably next month, she will be taking about the Dhatu Gata Vata, where we will understand this particular condition. So here I want to put it in brief. And then the next condition will be the Medo Pradoshaja Rogas. Medo Pradoshaja Rogas is along with the fat which is contaminated and freely floating or somewhere, the doshas which are also exacerbated in the body get the association of this fat. Medo Pradoshaja Roga. So these doshas will contaminate the fat further and cause many diseases. There is a chain of symptoms which have been explained in Ayurveda, including the Prameha Purvarupa, Ashtanindita, all those things are caused due to the Medo Pradoshaja Rogas. And then we have the Medo Roga itself. Here the Medas Avruta Vata. So when Vata functions are obstructed by the fat, many diseases appear. And gradually, if it is not treated, it goes to a very dreadful condition called as Medo Roga. The description of it is beautifully given in Madhava Nidana Uttarartha, where it looks like a big syndrome which correlates to the involvement of multiple organs in the body. So like a metabolic syndrome itself, it indicates. So once the fat is disturbed in the body, there are so many events happening in the body, outside and inside. Outside, it is demonstrated in the form of staulya and atistaulya. Atisthaulya is again another symptom of Medopradosha Roga, the Meda being contaminated by the dosha. There also we get the word Atistula. In Ashtanindita also we get the term Atistula. So Ayurveda, friends, has so many terminologies describing different stages of vitiation of the fat. These stages shall be understood. In these stages itself, the Medovaha Sroto Dushti, maybe Medasavrta Vata, where we are speaking about the atherosclerotic, the fat sticking to the walls of the blood vessels and blocking the free movement of Vata, can be compared to the atherosclerotic changes. So here we need to see where these conditions fit into the Ayurvedic terminologies. If we understand those things, the treatment pattern will be very, very easy. And very importantly, in atherosclerosis and other conditions, in these triglycerides, high cholesterol conditions, what we see in the blood vessels happening, we are discussing today, there is a Sangha Rupa Dushti. So coming to the Sroto Dushti, there are 4 types of contamination of the channels in the body or the srotas in the body. One among them is Sangha, that is contamination. When the floating fats adhere to the walls of the blood vessels, it causes obstruction in the form of atherosclerosis. Plaques are formed. This is considered as a Sangha Rupa Dushti, contamination in the form of blocks. It is a risk factor for many cardiovascular diseases. And coming to just last 1 minute, Heba sir. So in the treatment approach, Deepana, Pachana, Virechana, Svedana, I recommend Udvartana very importantly, and Lekana Basti. Lekana Bastis are very, very important in this particular context. And then we need to go with Medo Roga Chikitsa, the treatment. And here we need to see about Guru Apatarpana. Guru Cha Apatarpana has been mentioned. So here there is a tricky scenario of treating these conditions. If treatment for Medas is given, what happens in Medo Roga? There is Medo Avruta Vata. The Vata is there, and around that Vata there is Meda. If you give treatment to Meda, the fat will go away, but Vata inside will again outburst and present its symptoms. So if you give treatment to Vata, those treatments will increase Meda. That is the fact. So here the treatment should be balanced. So that is why Ayurveda tells to give Gurucha Apatarpanam. Like Santarpana and Apatarpana Gururaja sir was mentioning. Apatarpana is depleting treatment which are heavy in nature. Depleting is for Medas. Guru, that is heavy to digest foods, are for Vata. Because Vata is Lagu, light in nature. That is why heavy foods which take a plenty of time for digestion. Also gives an like limits the person who is obese to eat. So they have craving for food. When Guru Apatarpana foods are given, the craving also will come down. That is very important strategy here. Medovaha Sroto Dushti Chikitsa, treatment for the contamination of the channels. Langana, very important. Which form of Langana again should be a choice. Apatarpana, again I said Gurucha Apatarpanam. And Vata Chikitsa, once the Medas has been dealt with, there may be Vata symptoms which are aggravated. They too should be dealt with. Along with that, Pramehi Chikitsa is very important. Wherever there is Prameha as a symptom or as in the complex or in the syndrome, it should be implemented. Kapha Chikitsa, the treatment line for dealing with Kapha, should be done. And some medicines also I want to mention. Gururaja sir has already given a big list here. Gugulu will be a choice. Varanadi Kashayam, Varadi Kashayam, Pipala Kashayam. So these will be the choice. Gugulu Tiktaka Kashayam, Medohara Gugulu or Medohara Vidangadi Loha, and Aragvadarishta with very good success rate is given in obese conditions. Vyayama, exercise should be given, and customized diet protocol should be given. No Diva Swapna, the person should not be allowed to sleep during the daytime, because it is said if the person sleeps during the daytime, Naraha Pushyate Varahavat, the person will become as stout as a boar. So day sleep contraindicated. If possible, reduce the sleep of the person who is obese or having these cholesterol conditions. Jagarana is also indicated. So these are the different dimensions in which we should be looking at these particular cases and dealing accordingly. A thorough understanding of the pathogenesis, studying in between the words or the terms which have been given in Ayurveda is very important to deal with these conditions. Thank you, Heba.
Thank you, Raghuram sir. So with that, we come to the end of this session. Thank you all participants for your interesting questions. And we decided to go under the guidance of Gururaja sir and Raghuram sir. We decided to go with the questions that you have, so that these sessions become more useful and meaningful to you. Thank you all, and on behalf of all of us, students, my words of gratitude to Dr. Raghuram sir and Dr. Gururaja sir. Thank you, sir. Namaste.